Hi, I'm Dr. Patrick Proffer. I'm a board-certified plastic surgeon in Amarillo, Texas. I'm a member of the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgery. And today, we're going to have a little bit of an interactive discussion about breast implants and breast augmentation to hopefully answer a lot of your questions and clarify a lot of the information that's out there.
Dr. Proffer, you mentioned that there are different coverings for implants. What exactly does that mean?
Right, so the different coverings of implants are generally divided into smooth and textured. A smooth implant is the most common type of covering. It's consistent with what's on the inside of the implant as well. It tends to ripple less. It's a little bit of a softer implant overall. It gives probably the most natural result of all. The texturing is a little bit of a very gritty, almost very smooth sandpapery type covering, which certainly has some advantages as well. I think textured implants are terrific if we're doing combined procedures such as a lift with the texturing, with this extra grab, holding its position and making things much more accurate. Texturing is also a very good option for patients who've lost a lot of support in their breast. When we place the implant, it tends to want to grab and hold its position a little bit better, and I think that has a big effect and a big benefit long term. And lastly, we also know that just based on long-term studies that textured implants tend to form better scar capsules over time in general. And this is an example of a textured implant. So you can see it's a little bit more opaque than what we see with our smooth silicone implants. Again, exactly the same on the inside as far as the cohesiveness of the silicone gel, but a little bit of just a very fine, rough surface is what makes all the difference in this kind of implant.
Now, would someone be able to feel that internally or externally even after surgery if they had a textured implant versus a smooth implant?
Mm-hmm. So as we mentioned, smooth implants probably ripple a little bit less, which make them less palpable, and especially for a patient with very thin breast tissue, a textured implant may be a little bit more palpable. You may be able to feel that just a bit more than a smooth implant. On the flip side, the benefits of using that when you've lost a lot of support, I think, outweigh that small difference in palpability.